Thanks, ladies and gentlemen, for participating in our event today. I'm delighted to be here to introduce you to Bupa and to tell you about some of the things we do to make a difference in health and care around the world. So, Bupa was founded in 1947 in the UK when 17 provident associations were joined together by a group of businessmen and philanthropists who wanted to improve the ability of their members to access quality healthcare. And since 1947, the group has grown, and we're now a global healthcare company. And we believe we have unique breadth, unique scale, and unique expertise around the world. Articles of Association, written in 1947, they say that we were formed to prevent, relieve, and cure sickness and ill health of any kind. And this founding principle still guides the company today. We summarize our purpose: longer, healthier, happier lives. Very simple, but it's the reason we exist, and it's at the heart of everything we do as a company around the world. What it means in practice, simply, it means we want to improve the health of people around the world. That's what we want to do. Our customers, but also wider society where we can. And to help make this happen, we also want to work to ensure that health systems around the world are as efficient and effective as possible. Another important thing to note about Bupa is that we have no shareholders at the global level. We're a commercial company, we're a profitable company, and we make no apology for that, because it allows us to provide more and better healthcare for our customers, because we can reinvest our profits back into the company. And since we have no owners, we're not driven by short-term profit and can take a longer-term view of the best way to deliver our objectives. So today the company has obviously grown from its roots in 1947 in the UK. We have 79,000 employees today. We serve 29 million people in most countries around the world. But our major markets are Australia, the UK, Spain, Hong Kong, Saudi Arabia, Poland, New Zealand, and of course here in Chile. We see that health systems in all of our markets are facing challenges. The rise of chronic disease, aging populations, growth in healthcare costs, changing patient expectations, and demands from patients from their increasing demands from patients from their healthcare providers. Each market is different. There's no single answer that will work for everyone, but we have a lot of experience in markets around the world, which we'll be glad, and we're delighted and glad to be able to share here. In this market context, it informs our business model. We believe and are passionate in an integrated approach to health and care. We're a funder. We fund healthcare. We fund healthcare through our insurance businesses and our subscriptions businesses. We're also a provider. We provide healthcare through our clinics, our hospitals, care homes, as well as in the workplace and at home. And the third part of our approach is the work we do to engage and inspire people to adopt healthier lifestyles and reduce risks, particularly of chronic disease. And finally, our approach is to partner where we can with governments and others to improve healthcare systems and policies. We believe this approach, with all parts of the system working together, makes a difference for customers and for society. It means that it makes quality healthcare affordable and accessible, and it improves health outcomes for patients as well. So you'll hear later from my colleagues here, from my Bupa colleagues, in detail some of our experience from Poland and from Spain. But I wanted to leave you with 3 concrete examples of things we've done in other markets around the world that have had a positive impact on the health systems there. One from the UK, one from Australia, and then a global partnership we have with an NGO, Alzheimer's Disease International. In the UK, the regulator, the Competition and Markets Authority, recently investigated competition in the private healthcare market, particularly the market power of hospitals, of consultants in private practice, and the buying power of insurers. We welcomed the investigation. We were very transparent and proactive in our engagement with the regulator. We called for the regulator to take action to secure the long-term sustainability of the sector, and we argued for reform on behalf of our members. The regulator found a lack of competition and transparency about costs in the sector, found that private patients and insurers are paying more than they should for treatment by hospital operators, and ruled that a dominant hospital group in London and the UK should be broken up. And we haven't finished there. We continue in the UK to lead calls to reform the sector, and we've pledged to pass on any savings from those reforms to our customers, to create greater transparency and to improve value and quality for millions of people in the UK. In Australia, we've led the development of an innovative approach to funding healthcare that drives value for money for patients. In partnership with a private hospital group in Australia, which owns and operates 44 hospitals, we've moved away from a traditional fee-for-service to a model where the provider is rewarded by us for providing better healthcare outcomes in the areas of clinical quality and safety. This was a landmark approach for Australia, and it highlights the importance of the private sector working in partnership to create a sustainable system focused on better outcomes for patients. The final example is one where we've partnered with governments and an NGO to tackle one of the big emerging global healthcare problems, which is dementia. With Alzheimer's Disease International, we launched a joint global dementia charter called I Can Live Well with Dementia. For the first time, it outlines the rights that people living with dementia around the world should expect. Together with ADI, we're campaigning, it's an ongoing campaign, but we're campaigning for governments around the world to develop national dementia plans, to make dementia a national public health priority, and to make the 10 points in the charter a reality. And hopefully these examples will provide some food for thought for you here. And I hope this is a good introduction to Bupa and how we want to make a difference in health and care around the world. Thank you very much for listening. Thank you.